This Heart Month is the perfect time to learn about your risk for heart disease and the steps you need to take now to help your heart. Joining us to talk about heart health is Dr. Zia Khan, a cardiologist at Southern Hills Hospital. Thank you so much for joining us this morning.
Thank you, Nina, for having me.
Yes, and this is an important topic to talk about. It affects everyone. So please tell us, what are the signs that we should be on the lookout for?
So heart disease can mimic, several things. The typical classic way it presents is a central chest pain that's crushing and continuous, associated with shortness of breath, some sweating. It can go down your arm, even to your jaw. In women, though, these signs can be a lot more muted than men. So they have to be extra cautious about attributing it to heart disease. Best thing, if in doubt, call 911, get to an ER, and they'll take care of things.
And we were talking about, why is there such a difference between men and women? Is it just biological?
Some of it is biological, but some of it is also historical. Women tend to bottle things as far as their own health a little bit more than men. And there are certain subtle differences in their symptoms. So everything is a little bit more muted. For example, men may get profoundly short of breath, but women may just feel a sense of fatigue, and that may be a heart attack going on. So it's very important for them to know their risk factors beforehand. But there is some hormonal attribution to some of this, but by and large they're very similar. But women need to be more cautious because they always have everything somewhat understated in their symptoms.
So how do you know when it's actually there's actually the need for you to call 911, emergency chest pains, versus just sometimes you just feel a shortness of breath and it's not actually an emergency?
That's a really good question, because if you as a person have done your homework in terms of what risk factors you have, then these symptoms will be up and center in your brain. You'll react to them much better. So the advice is, know your risk factors. Is there a genetic history in your family? Are you a smoker? Do you have diabetes? Do you have hypertension? And if that's the case, then you are definitely, those symptoms for you are important symptoms. But if you're healthy, you pursue a healthy lifestyle, you know your cholesterol to be low, there's no family history, that person can kind of wait a little bit and see where this is going. But knowing your risk is very important.
That's really important.
Yes.
These are notes that we need to remember. So thank you so much for joining us this morning. We really appreciate it. And of course, we'll post this information at ktnv.com, and we'll be right back after this break.